Hello there, viewers. This is Remedy24. Today we are going to learn about the benefits of vitamin D. Because vitamin D is created in your skin in response to sunlight, it's also known as the sunshine vitamin. It's a fat-soluble vitamin that belongs to the same family as vitamins D1, D2, and D3. When your skin is physically exposed to sunlight, your body creates vitamin D naturally. To ensure proper levels of the vitamin in your blood, you can also acquire it via particular foods and supplements. Vitamin D serves a variety of purposes. The regulation of calcium and phosphorus intake and the facilitation of regular immune system function are perhaps the most important. Getting enough vitamin D is necessary for regular bone and tooth growth and development and enhanced resistance to some diseases. You're in danger of developing bone abnormalities like soft bones, osteomalacia, or weak bones if your body doesn't obtain enough vitamin D, osteoporosis. Here are 3 more vitamin D benefits that you might not know about. Number 1. Vitamin D fights disease. In addition to its primary benefits, research suggests that vitamin D may also play a role in 1. Reducing your risk of multiple sclerosis, according to a 2006 study published in the Journal of the American Medical Association. 2. Decreasing your chance of developing heart disease, according to 2008 findings published in Circulation. 3. Helping to reduce your likelihood of developing the flu, according to 2010 research published in the American Journal of Clinical Nutrition. Number 2. Vitamin D reduces depression. Vitamin D has been linked to mood regulation and the prevention of depression, according to research. Scientists discovered that persons with depression who took vitamin D supplements saw an improvement in their symptoms in one trial. In another study of fibromyalgia patients, researchers discovered that vitamin D insufficiency was more common in those who were anxious or depressed. Number 3. Vitamin D boosts weight loss. If you're trying to lose weight or prevent heart disease, vitamin D pills may be beneficial. People who took daily calcium and vitamin D supplement lost more weight than those who took a placebo supplement in one research. The increased calcium and vitamin D, according to the researchers, had an appetite-suppressing impact. Overweight people who took a daily vitamin D supplement improved their heart disease risk factors in another trial. Beware of deficiency. Many factors can affect your ability to get sufficient amounts of vitamin D through the sun alone. These factors include 1. Being in an area with high pollution. 2. Using sunscreen. 3. Spending more time indoors. 4. Living in big cities where buildings block sunlight. 5. Having darker skin. The higher the levels of melanin, the less vitamin D the skin can absorb. These factors contribute to vitamin D deficiency in an increasing number of people. That's why it's important to get some of your vitamin D from sources besides sunlight. The symptoms of a vitamin D deficiency in adults include 1. Tiredness, aches and pains, and a general sense of not feeling well. 2. Severe bone or muscle pain or weakness that may cause difficulty climbing stairs or getting up from the floor or a low chair, or cause you to walk with a waddling gait. 3. Stress fractures, especially in your legs, pelvis, and hips. A simple blood test can help doctors diagnose vitamin D insufficiency. Your doctor may perform X-rays to examine the strength of your bones if you have a deficit. If you have a vitamin D deficiency, your doctor will most likely advise you to take vitamin D pills daily. They may alternatively recommend high-dose vitamin D tablets or drinks if you have a severe insufficiency. You should also ensure that you obtain enough vitamin D from the sun in the foods you eat. Food sources of vitamin D. Few foods contain vitamin D naturally. Because of this, some foods are fortified. This means that vitamin D has been added. Foods that contain vitamin D include 1. Salmon. 2. Sardines. 3. Egg yolk. 4. Shrimp. 5. Milk, fortified. 6. Cereal, fortified. 7. Yogurt, fortified. 8. Orange juice, fortified. It can be hard to get enough vitamin D each day through sun exposure and food alone, so taking vitamin D supplements can help. How much do you need? The amount of vitamin D required for healthy functioning has been a source of debate. According to new research, you require more vitamin D than previously assumed. The normal range for blood serum levels is 50 to 100 micrograms per deciliter. You may require more vitamin D depending on your blood level. New guidelines based on international units, IUs, per day have been released by the Institute of Food and Agricultural Sciences. Drugs and vitamins are measured in IUs, which is a standard unit of measurement. IUs aid professionals in determining the appropriate dose, toxicity, and efficiency levels for each individual. One IU is not the same for each type of vitamin. An IU is determined by how much of a substance produces an effect in your body. The recommended IUs for vitamin D are 1. Children and teens, 600 IU. 2. Adults up to age 70, 600 IU. 3. Adults over age 70, 800 IU. 4. Pregnant or breastfeeding women, 600 IU.